I'm Dr. Matthew Johnson. I'm an interventional cardiologist here at Bryan Heart. I grew up in Stamford, Nebraska and went to high school in Alma, Nebraska. I think that I always had interest in cardiology stemming back from when I was a younger child. I had an irregular rhythm in high school and had to be evaluated completely before I could participate in athletic activities, and I think that tended to spark my interest in cardiology. This organization is the pinnacle of cardiology. I always tell the patient they're the captain of the ship, but you're going to give them recommendations and guidelines of what is the next step. And I think that they appreciate knowing that they have the final decision in some of these serious and complex decisions that they have to make. I've always put the patient first in practice, even when I was in internal medicine. I think that putting them first means that they have prompt care, the same care that we'd give your mom or your dad if they were in the hospital. I lost a friend this year who was only 38 years of age from a heart attack. I can remember one patient in North Platte, Nebraska, who was adamant about not getting a pacemaker, the hardware implanted on the left side where we traditionally implant it, because that's how he closed the gates in his pasture, was squeezing the gate together. Without that personal aspect of patient care, you don't really realize how just you can influence a patient's life or take away what they think is very important to them. You can get caught up in the technical aspect of cardiology, but it's the patient that matters the most. The future of cardiology is hard to determine. And I say that because it's always a moving target. You see things coming out in the future, such as the percutaneous valve, doing the closure devices from a peripheral aspect. One of the up-and-coming newer approaches is through the radial aspect, or through the radial approach for coronary intervention. That's one thing that I think that I can offer patients, is that the ability to go in, perform the procedure safely, lower risk from a bleeding standpoint, and maybe even have them on their feet immediately after the procedure, as opposed to laying in bed rest for 6 to 8 hours. The many different complex decisions we make in a day and the many different challenges that we face each day is what keeps my job very interesting. Time will tell whether or not these are going to progress and be as beneficial long term, but I think at this point the future is bright for cardiology.